Hello, we are on chapter 24, exercise and activity. Remember to review everything. Remember to read the book, read the chapter, write down notes, review and study. Make sure you know your objectives, key terms, abbreviations, know the skills, focus on communication, focus on rehabilitation, all the boxes and tables and figures. And anything else that you know that you need, when you go through and see those blue and green and pink boxes, make sure you check them. Do the review questions at the end of the chapter, and then check your answers after you have studied and everything. That's when you do your um, review questions. You know the contents are there on your PowerPoint handout, manual handout, and you can read through that. Just telling you briefly the different things that you would need to know. Exercise and activity. Being active is important for physical and mental well-being. Illness, injury, surgery, pain, and aging cause weakness in some activity limits. Inactivity, minor, whether mild or severe, affects everybody's system, affects mental well-being. Deconditioning is the loss of muscle strength from inactivity. When not active, older persons become deconditioned quickly, not just only older people. Nurses use the nursing process to promote exercise and activity in all persons to the extent possible. The care plan and your assignment sheet include the person's activity level and needed exercise. To help promote exercise and activity, you need to understand bed rest, how to prevent complications from bed rest, how to help with exercise. The person's care plan and your assessment sheet tell you the activities allowed. Now, in some of the nursing rehab and care facilities now have physical therapy within their facility now, and they do go to physical therapy and they do work out, and you do have some responsibilities with helping them. Always ask the nurse what bed rest means for each person. Check with the nurse if you have questions about a person's activity limits. Make sure you review the residents with dementia, exercise, and activity in the textbook. Generally, bed rest is ordered to reduce physical activity, reduce pain, encourage rest, regain strength, promote healing. These types of bed rest are common. Strict bed rest, some ADL activities of daily living allowed, bed rest with commode privileges, bed rest with bathroom privileges, bed rest with BRP, which is bed rest privileges. The doctor orders bed rest to treat a health problem. Sometimes bed rest is a nursing measure if the person's condition changes. Strict bed rest means that everything is done for the person. No activities of daily living, ADL, are allowed. For bed rest, some activities of daily living, ADL, are allowed. Self-feeding, oral hygiene, bathing, shaving, and hair care are often allowed for this type of bed rest. Complications of bed rest involve every system and include pressure ulcers, constipation, and fecal impaction, urinary tract infection, and renal calculi, which are renal stones, blood clots, thrombi, pneumonia, contractures, muscle atrophy, orthostatic hypotension, postural hypotension. When the person get up, get down, or move around, their blood pressure drops. Or syncope, meaning fainting. A contracture is a lack of joint mobility caused by abnormal shortening of the muscle. The contracted muscle is fixed into position, is deformed, and cannot stretch. Atrophy is a decrease in size or the wasting away of tissue. Muscle atrophy without muscles. is a decrease in size or a wasting away of muscles. Orthostatic hypotension is at normally low blood pressure when the person suddenly stands up. Slowly changing positions is the key. When a person moves from lying or sitting to a standing position, the blood pressure drops. Syncope, which means fainting, a brief loss of consciousness, can occur. On the left-hand side, you have the contracture, and muscle atrophy is on the right-hand side. Bed rest. Good nursing care prevents complications from bed rest. The care plan includes good alignment, range of motion exercises, frequent position changes. Supportive devices are often used: bed boards, foot boards, trochanter rolls, hip abduction wedges, hand rolls, and hand grips, splints, and bed cradles. A footboard is placed so the soles of the feet are flushed against it. Footboards prevent plantar flexion that can lead to foot drop. In plantar flexion, the foot plantar is bent flexion. Drop foot is when the foot falls toward the ankle. Permanent plantar flexion. Footboards also keep top sheets off the feet and toes. Hip abduction wedges are common after hip replacement surgery. Bed cradles help prevent foot drop and pressure ulcers. Supportive device bed boards, as you can see, A, mattress sagging without bed boards, and B, the boards are under the mattress, no sagging occurs. Supportive device, that's a footboard, as you can see. The sheet will not be on the feet, on the toes, but there's a board and the foot is flat up against it to keep the foot having foot drop. Trochanter roll. Then you have the supportive devices where you have the hand grip, in the middle is a splint, and then the finger cushion. On the slide 12, you have the trochanter roll is made from a bath blanket and extends over from the hip to the knee, and the right side was the hip abduction wedge. Bed cradle, as you can see, again, it will not touch the toes. The feet and toes are free. And on the right side is a trapeze. It's used to strengthen arm muscles. Some exercises occurs with ADL. When turning and moving in the bed without help. Range of motion exercise, ambulation are needed for muscles and joints. The trapeze hangs from an oval bed frame, and the person grabs the bar with both hands to lift the trunk off the bed. Exercise helps prevent contractures, muscle atrophy, and other complications of bed rest. A trapeze is used for exercise to strengthen arm muscles. The trapeze is also used to move up and turn in bed. An active range of motion, ROM exercise are done by the person. The movement of a joint to extent possible without causing pain is the range of motion of that joint. Range of motion exercise involve moving the joints through their complete range of motion. They are usually done at least 2 times a day. With passive range of motion exercises, someone moves the joints through their range of motion. With active assistive range of motion exercises, the person does the exercises with some help. Persons on bed rest need more frequent range of motion exercises. So do those who cannot walk, turn, or transfer themselves because of illness or injury. OBRA and CMS require an assessment and care planning process focused on a person's range of motion, preventing loss of range of motion, increasing range of motion, preventing further loss of range of motion. Range of motion exercise for the neck, as you can see on the far left, you have your flexion, which is going forward, extension, hyper extension is going back just a little. Then you have your rotation of your neck, going from right to left to right, however many times you're supposed to do it, and slowly. Always respect the neck exercises by doing everything in slow motion. And you have your lateral flexion, which is side lying your head, taking your head to the shoulder, bringing it up slowly, and taking it to the right. And you do that so many times. It's very relaxing too. You have the range of exercise for the shoulder. As you can see, the right arm goes up, which is flexion. When it comes down, it's extension. With the next one is abduction. Your arm is up in the air. It goes adduction, away from the body. And when you take your arm down, it's add, like adding to your body, adduction. Notice the spelling of the words ABD, taking away from the body. ADD, like in addition, math, you're going to adduction, add towards the body. External rotation, you carry your arm up, and then internal, you're rotating it down. With the arm exercising the elbow, you bring the flexion up and you taking it down for extension. Flexion up and extension down. Pronation, on the left side is pronation. You see where the arm, your hand, the palm is towards your body. And when you turn it outward, it's supination. Like you could probably put soup in your hand. Supination. With the hand wrist exercises, you go hyperextension up. Extension is flat straight out. And then flexion is going down. Your uniflexion, you go sideways. And the radical, you go towards, like you're going in towards the body. Range of motion exercise for the hip, you're going to be straight up standing. You're going to flex that leg up, and you're going to extension, taking it down, like the other leg is extended. It's down. The one is up is flexed. Same as your legs. When you're going outward, you're going away, adduction, away from the body. When you bring it back towards the body, it's adduction. Rotation on the left side with your legs. Internal, you're taking your feet to inward. External rotation, you're taking your feet and legs outward. Inward, internal rotation, outward, external. X means out. Ambulation. Some people need help walking. Some become strong enough to walk alone. Others will always need help. After bed rest, activity increases slowly and in steps. To achieve the goal of walking, contractures and muscle atrophy must be prevented. Proper positioning and exercises are needed during bed rest. Ambulation is the act of walking. Some people are weak and unsteady from bed rest, illness, surgery, or injury. First, the person sits on the side of the bed, dangles. Sitting in a bedside chair follows. Next, the person walks in the room and then in the hallway. Taking their time, gaining their strength. When helping the person to walk, you follow the care plan. Use a gait belt for transferring to hold on to so If they should start falling, you're just going to let them slide down gently. The belt, use a gait belt if the person is weak or unsteady. The person uses handrails along the wall. Check the person for orthostatic hypertension also. Always check for orthostatic hypertension. Regular walking helps prevent deconditioning. Some persons who use wheelchairs can walk with help. Walking aids, as you can see, you have the person on to the left in the corner, and she has crutches. Walking aids support the body. They may need temporary or permanent. The type ordered depends on the person's condition, the amount of support needed, and the type of disability. Crutches are used when the person cannot use one leg or when one or both legs need to gain strength. And those are the hand crutches up at the top that supports the arm. Safety measures. Follow these safety measures when crutches are used. Check the crutch tips. Check crutches for flaws. Tighten all bolts. Street shoes are worn. Clothes must fit well. Practice safety rules to prevent falls. Keep crutches within the person's reach. Know which crutch gait the person uses. So the person learns to crutch walk, use stairs, and sit and stand. Safety is very important. The person on crutches is at risk for falls. Practice safety rules to prevent falls. And that's in chapter 12. Loose clothes and long skirts may get caught between the crutches and underarms. This clothing can hang forward and block the person's view of the feet and crutch tips. View the crutch tips in chapter 24 figures. Your 4-gait and 3-gait and 2-gait points. Swing to gait and swing through gait. Make sure you know how to use those. The person is taught to use a cane or walker correctly and safely. Canes are used for weakness on one side of the body. They help provide balance and support. Single tip and 4-point quad canes are common. A cane is held on the strong side of the body. A walker is a 4-point walking aid. It gives more support than a cane. There are many kinds of walkers, baskets, pouches, and trays attached to the walker. Okay. The person is taught to use a cane or walker correctly. Like I said, 4-point canes give more support than the single tip canes, but they are harder to move. The cane tip is about 6 to 8 inches to the side of the foot. It's about 6 to 8 inches in front of the foot on the strong side. The grip is level with the hip. The standard walker offers the most support. Wheeled walkers are common. Rubber tips on the back legs prevent the walker from moving while the person is standing. Some have a braking action when weight is applied to the walker's back legs. An additional type of walker is a hemi walker. See figure 24. Hemi walkers are used for persons who have the use of only one arm or hand. For instance, someone who has a stroke or has a weak side. Walking with the cane, as you can see A, B, and C, how he walks through with the cane. And then you have a single cane and a single point cane and the 4-point cane. Those are the tips of the canes. Walkers, you have a standard walker, and you have the wheeled walker at the bottom right side, and there's the quad walker. When a person has a stroke or get only able to use one side. With braces support weak body parts. They prevent or correct deformities or prevent joint movement. They are applied over the ankle, knee, or back. You need to keep the skin and bony points under braces clean and dry. You need to report redness, signs of skin breakdown, and complaints of pain or discomfort at once. The brace is applied over the ankle, knee, and back. An ankle foot orthosis AFO is placed in the shoe. When the foot is inserted, then the foot is inserted. The nurse assesses the skin under braces every shift. The care plan tells you when to apply and remove the brace. Here braces again, as you can see, there's a leg brace and you have an ankle foot orthosis, AFO. OBRA requires activity programs for residents. A good activity program improves a person's quality of life. Activities must meet each person's interests, physical, mental, and psychosocial needs. Activity ideas are always welcome. Residents may share ideas with you and tell you about favorite pastimes, or you may have ideas, share these with the health team. They are given to the resident group that plans activities. Some persons need help getting to an activity. Some persons also need help taking part in them. You must assist as needed. Remember, OBRA, Omnibus Budget Reconciliation Act, also requires that persons be allowed to take part in resident group activities. Quality of life. You assist residents with exercise and activity. You must protect the rights to privacy and personal choice. The person's body is not exposed. Choices are allowed whenever safe and possible. You can promote activity by encouraging the person to be as active as possible, resisting the urge to do things for the person that he or she can safely do alone or with some help. Focusing on person's abilities, telling the person when he or she is doing well or making progress, telling the person you are proud of what he or she did or tried to do. That's the end of chapter of exercise and activities.